scan. So you should settle this hospital as soon as possible. You came in the morning.
At the moment it's pretty impressive, and I know there are issues. I admit there are issues, and two of the issues that we discussed today were shortage of space, and of course the shortage of some medicine issue. That's another one. The locums have started today, and we are trying to see how best we can accommodate two more locums to ease off the waiting queues. In terms of other facilities, yes, there has been some discussions with the board as well, because we see that the part of the old hospital that has not been utilized. So the Board of Visitors is going to embark on the renovation exercise for that project, which should be completed within 6 weeks to 2 months, Mr. Khan? 6 weeks to 2 months? Okay, and we hope to see, what should I say, solve the issue of space shortage, which I see as a major problem here. Other than that, these are issues that we're going to go back, meet up with the management team and see how best we can solve. I've also told the staff not to worry too much about the civil service reform. If they perform, we are here to remunerate them, especially in terms of specialist skills. And all in all, I am impressed with the way this hospital is going on. And if we can fix the other issues, I think that's the way we want the medical services to be in Fiji.